you everyone again for being part of this virtual panel. It's an honor to have you all as the guests and bring your perspective into marking this important day, World Mental Health Day 2020, which actually falls on October 10th. So again, I am Ashwin Kadambi. I work as a senior technical officer at International Medical Corps here in Washington, D.C. And I'm an ex-colleague of Maimunat, and it's a pleasure hosting this panel, or co-hosting this panel.
Yeah. Just echoing Ashwin, it's definitely a pleasure to have you both on this panel, Desmond and Dr. Abiri. Thank you for just being willing to share your perspectives on mental health, especially as the World Health Organization recently celebrated World Health Mental Week. And yesterday, in fact, October 10th, like Ashwin said, was World Mental Health Day, with the theme being increased investment in mental health. As you all know, like the World Health Organization defines mental health as the state of well-being in which an individual can realize his or her own potential and can handle the stresses of everyday life while productively and fruitfully making a meaningful contribution to their community and the society. So in other words, mental health really refers to one's cognitive, emotional, and social well-being. And, mental health, affects how we think, how we feel, how we behave, and is really crucial at every stage of our lives. So today I'll be introducing two panelists who will be speaking from the patient perspective and then also from the provider perspective, and would really want to hone in on mental health in resource-limited settings, especially in sub-Saharan Africa. So today I'm introducing Dr. Gbonjubola Abiri. Dr. Abiri is a consultant psychiatrist and managerial psychologist, professional speaker, and medical director of Tranquil and Quest Behavioral Health in Lagos, Nigeria. That's a mouthful. She's a co-author of the book Mental Health in the Workplace. She's a fellow of the West African College of Physicians, a member of Nigerian Medical Association, the Employee Assistance Professional Association, EAPA, and the American Psychiatry Association, APA. Gbonju has received trainings from King's College in London, the University of Washington, and the prestigious Harvard University in Boston, USA. Gbonju is passionate about research in child and adolescent forensic, women's mental health, and occupational mental health. She's also a mental health advocate who is driven by the holistic view to health, and as such, she's a regular voice on various print and electronic media, and I can attest to that. She's also really, really active on social media, and she uses illustrations and indigenous languages to reach her audience because care has to be contextualized for the needs. She also uses her knowledge in psychiatry and psychology to influence and maximize effectiveness and productivity in the workplace via the EAP program we mentioned earlier. Gbonju also volunteers her time with the Adorable Foundation International, which is an NGO against drug abuse, the Asido Foundation, and the Live Well Initiative. She currently also volunteers with the Lagos State COVID-19 Psychosocial Response Team as a means of contributing her own quota to the fight against the global pandemic. Gbonju works with THR Media as a consultant psychiatrist and a sexual and gender-based violence advocate. She's a member of the Global Advisory Council of Joy, Inc. Welcome, Gbonju.
Thank you very much for having me.
Thank you for joining us. And now on to Desmond. Desmond Jumbam is a health policy consultant who is based in Accra, Ghana. Desmond currently works with Operation Smile, a cleft NGO operating in over 30 countries across the world, advising and leading the organization on health system strengthening programs, as well as health policy and advocacy engagements. Desmond also leads research projects specifically focused on implementation science and health financing for surgical care in low and middle income countries. Prior to joining Operation Smile, Mr. Jumbam was a health policy analyst with the program in global surgery and social change at Harvard Medical School in Boston, USA, where he led and advised on the development of national surgical obstetric and anesthesia plans in several countries. Those plans are as well known as the NSOPs, and he did lead the development of those plans in Tanzania, Zambia, Zimbabwe, Namibia, and Pakistan. Desmond holds a Master of Science in Global Health from the University of Notre Dame and also a Bachelor of Arts in Biological Sciences from Taylor University. Welcome, Desmond. We're glad to have you.
Thank you very much for having me.
So I'll just run through a few key facts from the World Health Organization on mental health. It's estimated that around 1 in 5 of the world's children and adolescents have a mental health disorder, and that depression is one of the leading causes of disability, affecting about 264 million people worldwide. It's estimated that almost 800,000 people die by suicide every year. One person dies from suicide every 40 seconds, and suicide is the second leading cause of death in individuals aged 15 to 29 years. Around 1 in 9 people in settings affected by conflict have a moderate or severe mental health disorder. And it's also said that less than half of the 139 countries that have mental health policies and plans report that these are not necessarily, report having these aligned with human rights conventions. In light of that, it's just very evident that there is a rising increase in the burden of mental health disease, but we don't necessarily have the infrastructure to support mental health. And as we all know, COVID-19 is the elephant in the room. It's the global pandemic we're having to deal with now. And COVID-19 has actually in turn affected mental health. You know, this year's World Mental Health Day, which was yesterday, October 10th, it's coming at a time when our lives have really been upended for the most part, considerably due to the pandemic. The past months have brought many challenges for healthcare workers, for people on the front lines, for families, for children, for individuals living with any chronic health conditions. The mental health impact of this pandemic is not necessarily going to be seen now, but will be seen months from now, as you know, given past experiences of emergencies where you expect that the need for mental health and psychosocial support will substantially increase in the months and years following the end of the pandemic. So, Dr. Gbonjubola, based on this, it's known that mental health in sub-Saharan Africa accounts for about 6 to 8% of the total burden of disease in the region. What would you say is your experience with the burden of mental health in Nigeria and the region overall?
All right. Well, thank you very much for the question. And I think for a mental health professional who has worked in both public and private, institutions, I've been able to see quite a lot, and quite a lot, of course, apart from the fact that mental health disorders are not uncommon in a country like Nigeria. Of course, the WHO has continued to talk about how the global, global burden of mental health disorders is expected to reach 15% by the year 2020. And of course, we're in 2020. I like that you added when you were speaking about how the COVID-19 pandemic has thrown, a spoke in that wheel. And of course, it has made things a little more difficult for us around here. The burden is high. The numbers are high. Unfortunately, the attitudes, the perceptions, the beliefs, and, the nonchalance pretty much of the people who should take decisions, especially people in political offices concerning mental health issues, has not helped either. Coupled with, the fact that we are a developing country, we're exposed to poverty, ignorance, a lot of disease. We're a low and middle income country with poor social determinants of health. Our exposure to continuous, trauma, employment, and all the other negativities continues to put us at an increased risk for mental health disorders. Unfortunately, at present, an estimated 20 to 30% of Nigerians are, believed to suffer from mental disorders. And it's a significant number considering that we have an estimated population of over 200 million Nigerians. Unfortunately, however, the attention that mental health disorders in Nigeria get is abysmal at its best. The level of awareness is extremely poor. People do not know. people are not interested, and the misconceptions, of course, regarding mental health issues have continued to flourish. It would interest you to know that at present, there is no mental health bill in the country. The bill that is currently still being used is the Lunacy Bill of, I think, 1974. And while the current bill has passed its first and second reading, it's still at the public hearing stage at the National Assembly. There's no bill, or at least no document, that is available to help, guide the rights of mentally ill patients and ensure that they have access to qualitative care. So the emphasis, of course, should also, not end without me talking about the fact that a lot of the care that individuals who have mental illnesses and quite a lot of other illnesses comes from, out of pocket. Healthcare is not exactly, subsidized. So people, you can imagine that the minimum wage in Nigeria is 30,000 naira. And imagine if a person who earns less than, the minimum wage falls ill, chances are they may never even have access to the hospital. And then even if and when they have access to a hospital, they're limiting the needs, the cultural perception, and the fact that they may not even have access or better put, the cost of the care that they may need. Maybe, some of the factors that will continue to frustrate their efforts to seek care. And so, of course, these are some of the many factors that have continued to allow, mental health disorders to rise. And of course, the burden, morbidity, and mortality as well have continued to rise. Thank you.
Thank you so much, Dr. Abiri. And you do raise an interesting fact about just the poverty levels, and with the facts and figures that you quoted, that just shows a significant population in Nigeria, and I think the continent at large, lives on less than $1 a day. And that just even makes accessing mental health even more significant. So Desmond, I know you recently faced unimaginable loss and had to seek mental health services in Ghana. Could you elaborate more on your experience, please?
Sure. Again, thank you for having me. I'm delighted to be part of this panel to speak on an issue that, based on my experience, I think it's a very important issue, especially given the current COVID pandemic. And also delighted to be with Dr. Gbonju, to be learning from you as well. So my recent experience, is what really foiled me to gain an interest in mental health. Back in March of this year, right at when the pandemic was peaking in different countries, I was in Ghana. And I got a distressing call from my cousins here in Cameroon that my father had been brutally killed in the ongoing Anglophone crisis. And the Anglophone crisis, for those of you who don't know, is the 4-year conflict in the Anglophone regions of Cameroon. And it's a historical conflict that is based on the separation. So Anglophone is a majority, Cameroon is a majority Francophone country, but then there are Anglophone minorities. And over the past decades since independence, the Anglophones have felt marginalized, by the majority Francophone government. And so there was a civil war that broke out in 2016, and it has led to thousands of deaths and, hundreds of thousands of refugees to Nigeria and the rest. And so, unfortunately, my father was a victim of this conflict back in March, and he was brutally killed. And so when I got the news in Ghana, it was when the lockdown had happened. So the government of Ghana had instructed, it was the day that they had a lockdown. The whole country was on shutdown, borders were closed. The major cities of Accra and Kumasi were on complete lockdown. And so I struggled a lot because when I got the news, I had no access to friends. Not like for about 2 months, I barely saw anybody. And so this was a very traumatizing moment for me mentally. I had to mourn alone, and I had to struggle and to cope with that situation. And so as the days went by, I realized that I struggled a lot with getting out of bed. So normally I wake up at 5:30 or 6 in the morning and I go for a run, or I start work early, but I found myself waking up, getting out of bed at 10, sometimes 1 on some days. I find myself that even when I tried to work, I couldn't focus, I couldn't read, I just couldn't do anything. So I just laid on the couch and watched Netflix the whole time, and also found myself drinking, consuming more alcohol and eating a lot of food. So I became a bit depressed, quite depressed. But then I still had that tendency that we have, that I think it's common in Africans to not seek help for mental health, not realize that you need a mental health issue and just say, okay, no, tomorrow will be better. I just need to call family and all of that. But then I realized after many, many months that tomorrow was not getting any better. So I felt the need that I felt that I could not help myself out of the rut that I was in. So I reached out to, and also my job and my boss was extremely helpful and encouraged me to seek help quite a number of times. So I reached out to a clinical psychologist in Ghana, and he came. He was very flexible, and came to my house several times and just listened. And I found that just talking to him helped me in coping with the situation quite a lot. But then also there were other clinical psychologists in Ghana. When I reached out to people, they reached out offering free services to me. And so in a nutshell, I found that reaching out to that clinical psychologist helped me a lot to get out of that rut that I was in mentally.
It is both a difficult as well as an inspiring story on how you have really came out and seek the professional care. And Dr. Gbonju, what impact has the current pandemic has had on mental health, particularly in resource limited settings? Like Desmond has shared his story. Of course, pandemic has had very difficult challenges. It has posed difficult challenges on many people. And how has the kind of landscape changed with the pandemic globally affecting people?
All right. Well, thank you so much for that question. And I must answer that question without expressing my condolences to Desmond as well. So this is sending you love and light and all the strength that you need.
Thank you.
Yes, and yeah, you're very welcome. And so, the pandemic happened rather suddenly. It was unexpected. Nobody planned for it. We started 2020 with hopes, ambitions, dreams. I have places I wanted to travel to. I can only imagine what other people had planned, People had life prepared, and, unknown to us, by the 31st of December 2019, there we was cooking in Wuhan, China. And by, February, most countries in the world had started to have, an effect of what it was. By February, Nigeria had its first case. And, initially, a country like Nigeria and Africa, if I'm permitted to say Africa, had initially thought that, because of the low rates that had been reported in Black, even abroad, that were quite immune, either due to the color of our skin, our melanin, or our hot scorching sun, or, the climate that we have around here. And so when it did strike, interestingly, African countries were actually quite prepared. They had, modalities and mechanisms in place, as simple as, washing hands, the physical distancing, the quarantine, to mention but a few. And, while we were prepared physically for all of those things, no one or not many people were prepared for the mental health implications, which is something that has been said about the COVID-19 pandemic, that beyond this pandemic, the next pandemic that we're likely to have is a mental health pandemic. And so, interestingly, the COVID-19 pandemic was and still remains a significant stressful life event. It was traumatic, it was unprecedented, and like I said, it wasn't something that people were expecting. So it actually did cause significant trauma to individuals. And the kind of trauma that the COVID-19 brought along with it is the kind of trauma that is known as a process trauma. So now there are two types of trauma: an event trauma, a fire, a hurricane, and then it goes away. But the COVID-19 pandemic has been in our faces from that time. We're still seeing the effects. We've heard about the death. It's a novel virus. We hear about whether there will be vaccines. We hear about whether there's a resurgence. It continues to linger on over months. And the interesting thing about, the pandemic is that even though the pandemic happened and it appeared to be the most significant life event to most people, life did not stop for most of us. And so for someone like Desmond, while there was a COVID-19 pandemic, he unfortunately, still lost his father in, ongoing issues at home. And so for a lot of people, life did not stop. Some lost their jobs, some lost, their means of income, some lost houses, some lost, loved items. And, the sequelae has continued to go on because beyond the fact that the virus came to town and we knew nothing about it, was also the uncertainty that it brought with it. It was the fact that people were exposed to news morning, afternoon, night about the rising cases, about the numbers of deaths. We were also, faced with a restricted lifestyle. We're social beings, so of course we're used to, interacting with other people, and then all of a sudden, people had to live like a reclusive life. People couldn't go out. People, were faced with partners who they had not. Probably the most that they had spent with their partners was probably an hour, and then people were now locked up with people that they had not spent, months on end with. It was all of this was driving people crazy, and what we found, even in a country like Nigeria, was that there was an increased rate of mental health disorders at the time. So not only did we see new reported cases of mental health conditions, we also found that a lot of patients who had had previous mental health disorders started to have relapses. And so apart from, depression, mood disorders, anxiety disorders, we started to see an increase in substance, abuse disorders. So for instance, even Desmond had mentioned that he also found that he had started to increase his use of alcohol. So because people were faced with this significant stressor and did not know how to cope with stress, they had maladaptive coping mechanisms. Some people were self-harming. There were also increased, reported rates of domestic violence. So of course, what we found was that there were people who had broken down with new and old, cases. However, there was also the fact that a lot of these people did not have anywhere to go because a lot of the hospitals shut down, were not taking anyone, and unfortunately, family and friends had to start managing patients that they knew nothing about or had no idea what the management plan would have been. So it definitely took a huge toll on Nigeria. Thank you.
No, thank you for that insight, Dr. Abiri. And, like you had mentioned earlier about the burden of mental health diseases, there's a study out of Harvard that estimates that by 2050, there will be 130% rise in the mental health burden of disease. But now with the effects of the pandemic, how would you say that would also impact that mental health burden of disease? Do you think it's going to even be, much more than that?
Well, so without COVID-19, it was 130. What I was hearing you saying is, I'm just like, just make it, 100% improvement. You may have much higher than we currently have, especially because, aside the fact that the COVID-19 came by itself, it has changed quite a lot. It has changed how we see life, how we perceive life, how we live, how we interact with each other. And for instance, it has changed, livelihoods for quite a lot of people. And so, for instance, before this COVID-19 came, in the UK, loneliness was a big problem. When the COVID-19 pandemic hit and people had to go for quarantine, a lot more people became lonelier. And of course, with loneliness comes an increased rate in especially neurotic disorders. So neurotic and stress-related disorders and mood disorders as well. So if you even look at only the fact that the COVID-19 pandemic came and we're trying to find out what the dynamics of that would be, there's already an increased rate. If you now start to look at all other, negative impacts that would occur, trauma will continue. there will still be wars, there will still be crisis, there will still be inequality. All of these factors will continue to, add to the global burden of disease. So while that figure may appear, right for that year, chances are that it will be much higher than that. And, conversations such as this and anything else it is that we can do to stall or support people who have mental health, conditions, or even to keep, the general population in a good mental, space are extremely important.
Yeah. Thank you so much for that insight, Dr. Abiri. Desmond, you had talked about, the factors that at least necessitated you seeking care. So do you mind elaborating more on the factors that, came into play in you deciding to seek mental health? And then as a health system strengthening expert, what were some surprises and challenges you had navigating the health system?
So there are a couple of things that I think helped me. I think the first was having people around me who encouraged me to seek care. I don't think that's something that we should underestimate. Because I had friends and colleagues and my boss who kept insisting, to say, if you need care, if you need help, seek it, because it can be really helpful and try to destigmatize it in my head. So I thought that was really helpful. But then there also came to a point. I also came to a point where I realized how, kind of stuck I was. There's a certain situation where you think you can keep going, but at some point you realize that no, I'm in deep, pardon my French, shit. I'm stuck. And it's a very uncomfortable feeling. And I never really contemplated self-harm, but I think it's on that trajectory that I was, and I felt that I actually needed to get help. So there was that helplessness that allowed me to do that. The other thing that helped was the fact that it was offered to me at no cost actually. So my employers were very generous. They said, if you need to find therapists in the US, we can find that. But if you find one in Ghana who is available and you like, we're willing to cover the cost of that. So that also helped me quite a bit because I figured, if it doesn't work, then at least it's not my money. But it did work, so I was grateful for that. But that relates to the other point, to the second question, which is challenges around finding mental health specialists. So for me, since I'm in the healthcare community, I was able to reach out to some of my doctor friends. I reached out to a director at Kwalebu Teaching Hospital, one of the main teaching hospital in Ghana. And he was able to recommend a clinical psychologist that he trusted from the hospital. And so that helped a lot. And I had other doctors who recommended these other clinical psychologists. And I was surprised that a few of them actually offered their services for free to me out of compassion for my situation. So I really appreciated that. But this is an anomaly. My situation is an anomaly, I think, for other patients who need mental health in Ghana, in Cameroon, in Nigeria, across Africa, because they're not as fortunate as I am to have an employer who would recommend mental health for me and who would cover the cost. They're not fortunate to be like me in a situation where I had friends who could refer me to the right clinical therapist.
because this.
So those I think are some of the main things that affected my decision to.
I think just mentioned to
maybe we.
Yeah. So.
Yeah, we can ask Dr. Gbonju, based on information that Desmond has provided, that he had this kind of a support system with his friends. Do you often see that with your patients, like people having a good support system? Because from Desmond's talk, while he had really a good support system, usually our understanding is people don't seek mental health because they are afraid that people will mock them in the future, or they might even like ostracize them, and they don't want to kind of talk to them anymore. And those are the kinds of fear that people have usually in the society, is our understanding. Can you talk a little bit about that?
All right. Well, so when looking at the factors that or challenges or obstacles that individuals face when accessing mental health care, I'd like to look at it in a multi factorial dimension. But of course, I'd also like to cone it down to two, and that would be individual factors and environmental factors. So, for instance, individual factors, you want to look at bio data. So, certain what is the age of this individual? Is this individual an adult, or is he a child that care is being sought for? What is the gender of this individual? We know we live in a largely patriarchal society, which gives more credence to the male, and women very often are not to be seen or not to be heard. You also need to look at socioeconomic status. We have said earlier today that the average Nigerian, or that we live on less than $1 a day. The minimum wage in Nigeria at present is less than $1, 30,000 naira. So you also want to look at the type of illness that this individual has. Mental illness is a peculiar kind of illness, and I often say that in mental illness, the organ that is ill is the brain. When the brain is ill, how does it tell itself that it is ill? So those are some of the individual factors that can, affect individuals when seeking or accessing care. For the environmental factors, you have a potpourri of political, cultural, and social factors. And some of those factors, of course, political, will include the lack of the political will from the government to invest or to give attention to mental health. There is extremely low budgetary allocation that goes to mental health. In fact, the budgetary allocation to health is low. You can now imagine how much more lower it will be to mental health. You have issues such as social stigma, cultural beliefs, attitudes, and taboos that have continued to put persons with mental illness at the back seat. And the perceptions of their illnesses, the interpretations of their illnesses have continued to make it difficult for them to seek care. It definitely affects their health-seeking behavior. Then, of course, you also look at factors such as distance to a mental health facility. In Nigeria, presently, we have 8 specialist centers that provide psychiatric care. You have other centers in most of the states in the country, but first of all, the staff there are sometimes unwilling to even take care or cater to persons with mental illnesses. And then, of course, you have the cost of service, the waiting time at the hospital, transportation system. You have the utilization of non-orthodox healers, pastors, imams, traditional healers, to mention but a few. Unfortunately, this leads to a longer duration of untreated psychosis. And then sometimes we also have lack of available services to specialist groups such as children and the elderly. So, quite a lot of these factors have continued to affect or impact negatively as to whether or not people will seek help. While individuals, some family members may be understanding, what we find is that many times, most family members are even dissuading the person who have a mental illness from seeking help. They would rather point them in another direction and tell them, why not try this, first of all, before you eventually go to a hospital. So all of these are factors that have continued to, unfortunately, lead to, an increased incidence and, of course, burden of mental health disorders in a country like Nigeria.
Wow, thank you so much, Dr. Abiri. That's really insightful in helping us understanding the barriers that patients face in not just making the decision to seek care, but actually reaching care and accessing care. I think just reminds me of that 3-module framework for the World Health Organization. So Desmond, you had alluded to this in your experience about you having a unique experience with access to care. So from a health systems perspective, what do you think would be changes or modifications that you think need to be made in order to allow for increased access to mental health services?
Yeah, so Dr. Bonju has touched on this already. She's touched on the different barriers that are faced at an individual level, but also at a systems environmental level. And I think both of these need to be addressed from a health systems perspective in order to increase access to care. The first is, you have to think about the mental health, professional mental health workers that are available to deliver the number of services. And we know that in Africa, there's a dire shortage of healthcare workers, right? There's about 1.4 per 100,000 healthcare workers on the continent, as opposed to 14 per 100,000, I believe, in the world, globally. So there's a need to train more healthcare workers in order to meet that need, but also making sure that they have the necessary infrastructure that they can provide the mental health that patients need. The other issues are very challenging, and I think we need innovative solutions to that. For example, how do we decentralize mental health, right? Often patients, especially in the rural areas, I cannot imagine struggling with a mental health in a remote village and not knowing what you're suffering from. But even if you come to a realization that this is a mental health issue, you have to overcome the barrier of the stigma, raising this with your family members or with your church or with your mosque. And then, and then traveling on rough roads to get to Abuja or Yaoundé to find a mental health specialist and then dealing with those costs. So these are all systematic issues that need to deal with. But the other thing which Dr. Bonju mentioned at the beginning, I think there's a lack of political will. We need political will in order to effect these systematic changes that are needed to train more healthcare workers, to destigmatize mental health. I'm not sure what it will take because there's quite a number of other healthcare issues that ails the continent. We have rising global surgery and injuries. We have rising cancer burden. We have HIV and malaria and these other diseases that still prevails. But I think there's a need to raise the burden of mental health issues that are on the rise as a result of the COVID pandemic, but also just in general, like Dr. Bonju said, there was already a high burden before this, but now with COVID, there's an even higher burden. So we need to bring the ethical arguments to our policymakers, but then there's also an economic argument that can be made to political leaders to garner political will, because poor mental health has a significant impact on our growing economy.
Yeah, thank you so much for that insight, Desmond. So, Monju, you had addressed, and I think both you and Desmond had touched on it, about just the healthcare workforce globally and then specifically for mental health, because mental health, especially in sub-Saharan Africa, is usually low on the priority list or like health priorities. The World Health Organization's Comprehensive Mental Health Action Plan for 2013 to 2020 says that, low and middle income countries have an estimated mental health workforce or 2 per 100,000 population, as opposed to 70 per 100,000 population in high income countries or at least resource rich settings. So as a provider, what has been your experience providing services? Like, what's the average number of cases you see a day, you and your colleagues? And, what would be your recommendations to addressing that healthcare workforce shortage?
Well, thank you for that question. It got me smiling when you were reading out those figures, especially because I have more shocking figures.
Okay.
More shocking figures. More shocking figures when I say that, if you put Nigeria's current population at 200 million, at present, we have less than 200 psychiatrists in Nigeria. So, to every 1 million people, you have one psychiatrist trying to take care of 1 million people. Good thing is, so it's a mental health team that takes care of all of these individuals. But you also find that there's a, massive brain drain ongoing. In fact, somebody still said to me this morning, when are you coming to join us in the UK? And I said, well, for now, I'm not going anywhere. So there's a massive brain drain ongoing.
Yeah.
There's, I like when Desmond said we should train more. We're training, but we're losing the ones that we're training. Because unfortunately, the environment is not right, and individuals just feel they should go where they are better appreciated and where things work better. And so, if you have one psychiatrist to 1 million people, you can only imagine how much emotional labor the psychiatrist will have to go under. There are days I just turn off my phone because even I feel overwhelmed by the work. When I used to work in public practice, sometimes we would have 20 patients. 20 new patients at the emergency every day. We had a hospital with a bed space of over 500. And there were times that people will come and there will be no bed spaces. So that's one specialist hospital in Lagos. Chances are if they went to any other government hospital in Lagos, they may not even have, admission facilities for the individuals. And of course, before they leave Lagos to go to other places, your guess is as good as mine. People would rather just go to churches, mountaintops, mosques, herbalist homes to get the care that they need. It's rather unfortunate, but it's the reality that we have found ourselves. At present, I manage a private psychiatric facility, and we have 2 branches in Lagos. And at present, as I speak with you, one facility is already full to capacity. There are days that people are trying to get in on the list. In fact, as at Friday last week, my schedule for this week is already filled up. So you have a lot of people who require care, who unfortunately may never be able to get the care, especially because the healthcare force on ground, the workforce on ground is, limited in number, limited in capacity. And unfortunately, at the end of the day, even when these people are able to access care, can they afford it? Can they sustain, the care? Especially because unfortunately, a lot of these, mental health conditions are chronic and will continue to require care. And that care is not just biological care in form of medication. You also have psychological and social care. It's difficult, I must be honest with you, it's extremely difficult. And I think that, efforts such as this and any much more that we can do to ensure majorly promotion and prevention will go a long way. Because if we keep waiting until, these people are on the other side, it will become more and more difficult for all of us to manage.
Well, thank you for that insight, Dr. Abiri. It's funny you said the numbers are even more stark than what is reported by the World Health Organization. So we had discussed just like the mental health action plan, and earlier on we had talked about the number of countries that actually had their plans aligned with human rights considerations. So Desmond, from your experience, developing NSOPs, that's those national surgical and obstetric plans, and having to implement those, what do you think are some of the lessons that you've learned from that experience that can be translated to mental health plans?
Having a plan is not enough. I think we're too quick to develop plans. I think plans are necessary. You can't systematically address a problem if you don't assess what the problem is and if you don't come up with strategies and goals and targets and all of that. And I think it's absolutely valuable to develop plans for surgery and for mental health and for cancer. All of those are vital. What I found is especially important is getting the political will behind that plan, to make sure that the resources are available for the implementation of the plan. And that's a challenge that we see with these national surgical obstetric and anesthesia plans that are been developed around the world, including Nigeria. Nigeria has an NSOP with a price tag of about $1.6 billion over the next over the next 5 years. So the question is, how are we going to finance that plan? And so I think, yes, we should develop national policies to address mental health, national plans to address mental health. But the real challenge is getting the political will from the leaders to institute the policies, to put the funds to implementing these plans, whether it's training more mental health care workers, and retaining them so that creating the right environment so that they stay and work in the countries. Because honestly, I can't blame them for leaving. We often say, there's brain drain, but if you've worked in the conditions where where some of our healthcare workers have to work in, you would not blame anybody for leaving. So we should get our policymakers to put their money where the mouth is, And then the other thing I think the private sector has a role to play in this as well. Unfortunately, I don't think the other countries that have developed national surgical plans have involved the private sector enough. And so as we're developing national policies for mental health, we should find ways to engage with the private sector, because even with the advent of COVID, there are innovations that are coming out of the private sector. I believe in some countries, most of the mental health, perhaps in most countries, most of the mental health services are being provided online at this point, and some patients find that better than in person, some not so much. But there are these innovations that can come from the private sector that we can definitely leverage to increase access to mental health services on the continent.
Yeah, thank you for just sharing your insight and expertise, Desmond. And like you say about conditions that healthcare workers have to work in, I definitely do have my own story, and that'll be shared for another day. But yes, it's you cannot just talk about training healthcare workers, like what you said earlier, without necessarily building the infrastructure to support ongoing services and just ensure that healthcare workers have good working conditions. So Gbonju, I would just like to read from your LinkedIn post yesterday where you said, talking about, you just highlighted or expanded on the theme for mental health care for this year, and it is mental health for all, greater investment, greater access, everyone, everywhere. So I think in closing, now that the World Health Organization and everyone else is advocating for increased investment in mental health, what would be top 3 to 4 priorities that you would want to invest in related to mental health?
So sometimes, when we get this kind of questions, we feel like, oh, it's tough. It's like saying it's psychiatric to be Minister of Health for a day and try to do what it is that you can. But I think that it's important to, first of all, continue the increased advocacy and awareness to the population, targeted at changing the perception and attitudes of people towards mental health. If we don't change this, we're pretty much, beneath the surface. We're not scratching the surface just yet. The other thing that, of course, I would want to focus on is inclusion of key stakeholders. Because beyond having a plan, like Desmond said, is the fact that you need to include the people who are relevant to this plan. And of course, that would include the users, the user groups, the providers, healthcare providers, the influencers, and government as well. I feel like, somewhere in between all of this, you'd have cultural and religious organizations also lending their voices. Extremely important and should never be taken for granted. Of course, I would also, like to weigh in on integrating mental health services into primary health care. Fantastic thing is the WHO has, tried to do this with the WHO mental health, gap. And, the intervention plan. And it actually did work because what it focused on was addressing and scaling up provision and utilization of mental health services in Nigeria. So for instance, at present, the Lagos state government has at all of its flagship centers, and I think that's 57 flagship centers in Lagos, there are mental health care services. There's access to mental health care services for individuals who may need the care. So of course, integration of mental health into primary health care is where the people can get the care when they need the care. The last but not the least is I would like to, talk about how we can galvanize all the few professionals, the mental health professionals. There's very often you find that there's a bit of a problem where people feel like, oh, with a hierarchy system, why should the doctor be the head? Why should the nurse not be the head? I think that we should start to, to look beyond all of those issues and think about what our theme and our focus is. Our theme and our focus, of course, is ensuring that people who need the care get the care, and that, of course, the gap between our brand promise and our service delivery is not wide. The wider it is, of course, the more distressing and, of course, the more stressful it is to the individual. So I would encourage that, healthcare professionals also put all hands on deck. So psychiatrists, psychologists, occupational therapists, mental health nurses. We should put our money again where our mouth is. It's not easy working in, a country like Nigeria, I must tell you, where every day you are given a reason not to believe in the system or the country. It takes a lot of will, it takes a lot of courage, but I think some of us have committed to it. And I think I would end by saying we need all the support that we can get from, from outside the country, but of course we must first of all start with ourselves. Thank you.
So Desmond, just like Dr. Gbonju has ended, she said, it starts with us. And I saw, by the way, to all our viewers, we will provide the link to Desmond's article that he has published in LinkedIn. You should definitely check out that article. It has a wealth of advice for people to seek mental health. And it's a pretty enlightening article. But the question I have for you today, Desmond, is what advice do you have for people who know of someone who's going through a mental health crisis or mental health situation? So from this conversation, that's what I learned. People, not only the person himself, but the people around are as much important. So what kind of advice do you have for them?
So for those who know of someone who's going through a mental health crisis, based on my non-expert, non-clinical patient standpoint, I think the first thing I would say is to be supportive of them, in the sense that what helped me was having others who encouraged me to seek care when I needed it. And that's, again, not something to be underestimated. So you can encourage them to seek care and try to destigmatize it, because even someone who is struggling from a mental health may not be aware that that's what they're struggling from, and they may be afraid to tell their friends right. So I think that's one thing. And in the article, I just give a bunch of things that works for me, like encouraging them to stay active. And I think there's some evidence that if you exercise, it has benefits for your mental health. For me, what helped was, again, I had endless calls from friends and family who called to talk about nothing and everything. So that could also be helpful. And the last thing is I think social media has a tremendous impact on our mental health in good and bad ways, right? In good ways, I think it's helped us during this pandemic to stay close in contact with our loved ones, even though we're far away from them. But we're also inundated by the news, we're inundated by comparing ourselves to others on Instagram and the like. So taking a distance from social media and developing healthy social media behaviors and practices will be beneficial.
Thank you, Desmond. Any closing words on this question, Dr. Gbonju?
Well, so I mean, I think I will put it, simply in the acronym LLL. Look out for them. Look out for individuals who you are concerned about, worried about, and I feel like right now all of us should look out for each other because we're actually in extremely difficult times. It's sometimes tempting to not look out for the one who always appears strong, not knowing that people have conditions such as functional depression and may actually be going through their own stuff. So let's look out for each other. The second thing I would say is let's listen. We should listen intently, be kind and compassionate and non-judgmental when people come to us with their issues or whatever problems that they have. And the last but not the least would be that we should link them with sources of hope, help, and support as they go through, whatever difficulties they may be going through, either through a mental health issue or through a mental health condition or life difficulties at, its best. Thank you.
Well, what a perfect way to round up Desmond and Gbonju. Like this has been insightful. I know Ashwin and I have learned a lot, and we hope, the people that will be watching this video would really learn a lot out of that. And I really love how you ended with the 3 L's. I think as piggybacking off what you said, Desmond, on the ills and then benefits of social media, I would like to at least lean on the benefits and say you can follow both Desmond and Gbonju on social media. Desmond tweets consistently about surgical health, health in resource limited settings, and as we said earlier, he's a health policy analyst. So you can follow him on Twitter at Desmond Tanko, and you can also please read his article that he shared that Ashwin highlighted earlier, which it says there's nothing on African about seeking mental health, and that is a really insightful article, and it really elaborates on his experience that he shared earlier. You can also follow Dr. Gbonjubola on Twitter, Instagram. She does support a lot of courses on mental health, is really active on social media. She also has some programs and initiatives she runs. 1 minute with, is it Mental Health 1 Minute with Ask Dr. Gbonju 1 minute.
Wait a minute.
Wait a minute. Yes, thank you for clarifying that. Wait a minute. And then she also has other illustrations and initiatives she does on social media, like Ask Dr. Gbonjubola Abiri. So you can follow her at Dr. Gbonjubola Abiri. Once again, thank you both for lending your time and expertise. And like you said, we hope this is us contributing our own quota to increase awareness on mental health disorders, to continue to advocate for mental health resources as part of the World Mental Health Day activities. Thank you all for your time, and hopefully we'll see you all soon.